Hey guys, just want to talk to you guys today about a bit of low back pain stuff. So low back pain is unfortunately one of the most common presentations that physios see, not just in Australia but around the world. Rates of low back pain aren't necessarily decreasing, and we tend to be seeing a little bit more of your persistent low back pain or your episodic low back pain coming through a little bit more. So in those sort of cases of your acute low back pain where, I don't know, you've bent down, you've gone to pick something up, and you've just had this sharp, sudden onset of acute low back pain, there's a few common mistakes that I find a lot of people tend to make. The first one that is really, really common is people think that rest is the answer. If we go back 10, 15 years in physio, rest was probably what everyone was told to do. But the research is starting to trend away from that towards what is termed now relative rest. So relative rest means being able to do what you're comfortable to do, be up, be moving about, still using your back, still bending, still extending, but within your comfortable limits. Realistically, I think a lot of what feels like your back is stiff, locked up, like it can't move, is a lot of protective muscle spasm. That is a completely natural and completely normal thing to have happen. But if that sticks around a little bit too long, it probably becomes a little bit more of an issue. Whereas if you can keep moving, you can keep active in those early stages, that muscle spasm is going to go a little bit quicker. Probably one of the other big things I see a lot of people do is they go for immediate scans. X-rays, unless we're looking at is there a trauma, or are we looking for a potential fracture, or unless we're looking at specific teenage cases, probably not a fantastic choice of imaging. And then probably the next one is MRI that a lot of people will go for. Not fantastic when we're looking at how great our MRIs are picking up clinically relevant information. Realistically, for me, unless I'm looking at very specific symptoms that I can correlate to a clinical assessment, or I feel it's going to change my management pathway, I don't feel early imaging is necessarily required. And also those certain symptoms we're looking at numbness, true muscle weakness rather than a pain-inhibited weakness, and reflex losses on a clinical exam. So unless there's really those symptoms that are present, the clinical need for an MRI really, I don't feel, can be justified. There's also a little bit of research that indicates that those people who undergo early MRI imaging take longer to get better and their cost of care is higher. Which to me indicates that the need for those high level imaging probably isn't there in most cases. Third mistake I see a lot of people make is they stop doing all of their regular exercise routines. At some point you might not be able to go for your usual 15k long run on a Sunday, or you might not be able to do your speed run on a Tuesday or go to soccer training. But if you can replace it with something that's slightly lower intensity, like going for a walk, getting in the pool, walking around, doing some light body weight exercise in the pool, where the pool can take away some of that pressure on the joints and on the back, and you can still stay active and still stay moving. So if you can just take away what's too much and replace it with something that you can do, that might only be short, might only be 5-10 minutes, but 5-10 minutes is better than nothing. I think probably something that a lot of people do tend to do, but maybe don't quite use it properly and probably don't get the most effect from it, is hot packs. A lot of what I hear people tell me is they put a hot pack on and they sit down, they'll watch TV or they'll sit in bed and then they'll leave it on for an hour and a half. Probably not going to get your most bang for your buck out of your hot pack using it that way. So if you can get a stretching program, you can get some mobility exercises, you can get some light strengthening. I think where most people I find tend to get the most benefit is they use the hot pack, they put it on for 30-40 minutes, and then they do their exercises after. You don't need to do a heap of exercises, you don't need to do a heap of mobility work, but that hot pack is going to free up through those muscles. It's going to calm down that nervous system a little bit so that you can get 10% more out of your exercises. And that's what it's going to be about. It's going to be slowly chipping away, improving that range of motion, improving that pain irritability, and settling those symptoms down. Hot packs and exercises are one of your best ways to go about it in terms of self-management strategies. Early assessment, really, really beneficial. So if you can get into a physio, you can get into your GP to give you your pain medications to try and keep everything settled. Otherwise, if you can't get in to see your GP, your local pharmacist is an option as well. So if you can manage those symptoms, get in with your local physio to get a good quality hands-on assessment and get some good treatment in terms of hands-on and potentially maybe some strapping as well. Again, just to reduce that irritability and try and reduce that muscle spasm. That can get you on a really, really good foot moving forwards. So I think in terms of self-managing early on, heat pack exercises and get in to get a hands-on assessment done. Any questions, drop them in the comments or shoot me a message. Always have a great week.